Cold Lake Health Services has really grown over the last 20 years I've been here now. If we look back on our health services, when I first arrived here at the Nation, we were still paper and pen, still very archaic type of charts. The actual hard record was a paper-written record that was subject to the person who was doing it. So there was really no standard documentation on those records.
We had like boxes and boxes, or even, never mind, all those ones we had to push them and pull them.
There was a lot of files buried, there was a lot of files lost. Like, I can't remember how many times I'd spent hours looking for a record that had been misfiled. Prior to that, there had been some historical programs that Health Canada had tried to introduce that had failed miserably. But I believe they failed because there was no consultation. We saw that when Dr. Sal came out here and started talking about the implementation of CHIP, and recognized very quickly how important that was going to be for the First Nations going forward. Now, the Community Health Immunization Program, or CHIP, was a way for us to document vaccinations. CHIP is basically a database. So it's a database that allows us to enter all of our clients' information. And it changed actually the entire workflow within the community. It really prompted us to look at the actual data that we were collecting. We weren't just doing a job, but we were collecting and assessing all at the same time. Janice is our public health nurse who has really improved our immunization rates because she doesn't take no for an answer.
As a public health nurse, I use CHIP every day in the care of adults and children. My job is to make sure everybody's well immunized and protected. Using CHIP, all that information is in there. I can access, should they have been on another First Nations reserve and received immunizations, I can see it.
Once CHIP was implemented, it made it so much easier for our nurses to be able to see what immunizations have been received and what they need to receive.
They've added so many additional functions to it that, you know, if one of our children goes to Frog Lake or Kihiwin or to any First Nations within Alberta, I can actually type their name and their Alberta Healthcare number into the system and it calls up their immunizations. I can see it if they've gone to one of our First Nations health centers. If they haven't gone to a First Nations and they've actually gone in through public health, through an Alberta Health Services site, I can still access those records. It was about 2014 or 2016 they introduced the RTI function, which allowed me then to access Alberta Health Services through Netcare to bring down those immunizations, again, saving us a tremendous amount of time. So just in that time management part of this program, like, I mean, it really did propel us into the 21st century, and that we weren't spending hours chasing records or documenting on records. We realized the value of it, and we really dug our heels in when it came to Health Canada, because they were, you know, kind of trying to put the program at bay, and we're like, no, we need this. I think over time, people realized the utility of CHIP and how important it was to have made that change.
Those reports are what helps me to keep the immunization rates up, so that if we ever have an outbreak, let's say of measles, we can look back and say, look, our kids are well vaccinated.
These were all kind of like learning curves for us when we first started getting onto CHIP, but again, it set us up for success when we implemented a primary care, like with our primary care provider, and it sets us up for success as well now with our mental health program, because we have a database now with all of our clients' information in it. Like, just from 2012 till now, and how much we grew during that time, and being able to open up the scope of nursing by just that additional individual, and by having the tools to do that. Because without the tools, we wouldn't be able to do that at all.